Probably the biggest thing here was in hematologic oncology was actually in the myeloma area. 2 new monoclonal antibodies, the ELOQUENT study looking at adding antibody to lenalidomide plus steroids to try to see if we can improve the outcome for patients with relapsed refractory multiple myeloma. And that really showed us that we can add the monoclonal antibodies to standard of care and improve the response rate and the outcome for patients with relapsed refractory multiple myeloma. And the second one was the daratumumab, which is an anti-CD38 antibody. And that also, in patients that were very heavily pretreated, 5 prior therapies, had a 30% response rate, which I think is very, very respectable in that patient population with minimal toxicity. So probably the whole area of monoclonal antibodies for myeloma was one that was really well represented here. There hadn't previously been any antibodies that have been approved for multiple myeloma, so that's an area of really excellent outcomes. As far as other diseases, the other big abstracts here were trying to look at, again, some antibodies and using those in different types of patient populations, such as obinutuzumab, which is approved for CLL, and there was a large trial here looking at bendamustine plus or minus obinutuzumab for patients with indolent lymphoma who had previously failed rituximab, and so they were refractory to anti-CD20 antibody therapy with a different antibody, but could still respond to the obinutuzumab in that combination trial. So that was a big study here. And then also looking at ibrutinib addition to bendamustine for patients with CLL appeared to improve the outcome for patients quite a bit as well. So I think probably the combination therapies, immunotherapy, pathway therapies, those are really the ones that we're looking at for hematologic oncology.